Welcome to Module 3 of our teaching modules on centering the public interest in integrated administrative data analytics. In this module, we're going to look at label bias, and we're going to do so through an example in homelessness data analytics. So after learning about the FAIR2 framework in Module 1 and hearing insights gathered during our data chats in Module 2, we are now going to talk about two types of bias that tend to arise in the analysis of administrative data. Those two types of bias are label bias and collider bias, which will be looked at in Module 3 and Module 4. So, like I said, in this module, we are going to look at label bias. So let's first take a moment to see how label bias may play out in real life. Jessie has been on her own since her parents kicked her out at 17 years old after she came out as a trans woman. After staying with various friends, Jessie found herself in a relationship and moved in with her partner for several months. However, the relationship suddenly went downhill, and it was not safe for Jessie to live with her ex anymore. Jessie is not sure where to go and is running out of friends who will let her spend a night or two on their couch. Jessie is looking into shelters, but is scared to go as a trans woman. Plus, her ID still says male, and she doesn't feel safe in a men's shelter. Now, simultaneously, Casey is a social worker tasked with doing a needs assessment. They have a hunch that LGBTQ+ folks are in need of more services. Casey pulls records from the biggest homeless shelter in the county for the past 5 years. They plan to compare demographics of those serviced by the shelter to demographics in their county. To Casey's surprise, very few LGBTQ+ folks and nearly zero trans folks were in shelter. Casey concluded, wow, the LGBTQ+ community must be so strong that they find help within their community. Jessie shows us that there are multiple reasons why someone may not seek shelter, such as safety and stigma, which are particularly salient for marginalized populations. Now take a moment to think about other reasons why someone might not be able to seek shelter. Besides safety and stigma, these might include health issues, disability, and immigration status. Now remember what Casey concluded when looking only at shelter use data, that the LGBTQ+ community must be so strong that they find help within their community. Now, as we go through this module, think about what Casey and other community workers might be missing when assuming that shelter use data alone is representative of the population experiencing homelessness. Now, going off of Jessie's example, let's think for a minute that we are social workers who work with people experiencing homelessness. Oftentimes, we see people with experiences of chronic health issues and poverty. Our team received administrative data on people who have used shelters in our county, and we are asked to analyze two things. First, the effects of poverty on experiences of homelessness, and second, the effects of health status on experiences of homelessness. Thinking back to Jessie, we know that people may experience homelessness outside of shelter for multiple reasons. Now, we want to alert our team that the administrative data may systematically miss more vulnerable people. But first, what is label bias? Well, we're interested in seeing how poverty and health relate to homelessness. Homelessness, therefore, is our outcome variable of interest. That is, we want to measure homelessness. However, our measured variable, or label, is actually shelter use. That is, shelter use is an imperfect proxy for homelessness. The graph on the left represents the hypothesized relationship between our two variables. Poverty directly impacts health issues, and it also directly impacts homelessness. The plus sign means that when there is more of one thing, like poverty, then we get more of the next thing, like health issues. On the other hand, the negative sign means that when we have more of one thing, like health issues, then we actually get less of the next thing, like shelter. So for people who experience more health issues, they may actually be less likely to seek shelter due to those additional barriers. Now, if we zoom in on our desired outcome variable, homelessness, and our measured outcome variable, shelter use, we need to ask ourselves who is getting left out. In other words, who is experiencing homelessness that may not be in shelter? So this is label bias. Label bias occurs when the variable used in data analytics is only a proxy label for the outcome of interest, which is often something that's difficult to measure. So for us, true homelessness is our outcome of interest, and it's often difficult to measure. However, shelter use is that proxy label that we're using for our outcome of interest. By studying homelessness with data on shelter use, or using shelter use as a proxy label for homelessness, it may lead us to conclusions that reproduce historical inequities and human bias and reflect disparities in society. So in our example with homelessness, who gets left out? Why do they get left out? And how does this reflect disparities and bias in our society? Well, first, we have to ask ourselves who is missing in shelter use data. Thinking back to Jessie, we know that she may be missing in shelter use data due to safety concerns and social stigma, despite the fact that she is experiencing homelessness. In this example, we also see how health affects both homelessness and shelter use. So even though greater health issues may increase the chance of experiencing homelessness, they may also decrease the chances of being able to seek shelter. Now remember in Module 2, where we shared our data chat process to integrate community knowledge into our assumptions and analysis of data. One of our data chat participants said, "Your mental health comes first. If you're not there, then you're not actively going to seek help. Your mental state should be taken care of, because we can put people in houses or we can put them in shelters, but are they actively working with a psychiatrist? Are they actively working with the mental health system?" So we try to reflect these insights about health and how it affects homelessness in our very simplified model shown on the right-hand side of the slide of poverty, health, and homelessness. As we've now seen, there are many reasons why someone experiencing homelessness may not seek shelter and subsequently not appear in our model. Safety, especially for marginalized populations like LGBTQ+ folks. Stigma, remember that Jessie was struggling to decide if she should seek shelter because of both safety as a trans woman and the social stigma that oftentimes accompanies marginalized gender identities. As one of our data chat participants said, the worst thing is that you share your information with somebody, and instead of them helping you, they're judging and categorizing you. Mental health, as we just discussed, is another reason. Yet another reason that our data chat participants identified was that social services often lack a feeling of connection or relationship and can leave people feeling like, quote, just a number. Finally, people may not be able to seek shelter because services are simply not accessible. Now, to see firsthand how label bias arises in analysis, we simulated individual level data on people's experiences of poverty, health issues, homelessness, and shelter stay. This exercise was coded in R, and you can access the HTML file for yourself and walk yourself through this example. So in the table below, we have 4 variables that we use to simulate this individual level data. We have the type of variable they are and also the meaning we assign to them. So for this example, we model poverty as a binary variable, meaning that an individual is either experiencing poverty, a 1, or not, a 0. We then gave each individual a health score, which is a continuous variable where higher values indicate worse health status. Homelessness is another binary variable, meaning that an individual is either experiencing homelessness, represented by a 1, or not experiencing homelessness, represented by a 0. Finally, an individual is either in shelter, a 1, or non-shelter, a 0. Now we used those variables and created simulated data on individuals. So this graph gives you an idea of that continuous health score variable. You can see that most people have an average health score, which is why the bar in the middle is the highest. Now, as you get closer to the extremes, either very bad health or very good health, the amount of people with those scores gets smaller and smaller. Next, we overlay that health score data with the effect of health issues on homelessness. The color tells us what percent of individuals counted in each bar is also experiencing homelessness. So as health scores get worse, we see that that percentage increases, meaning that people who have worse health tend to be more likely to be experiencing homelessness. On the other hand, people who have very good health tend to not be experiencing homelessness, which is going to be represented by a different color and also a lower percentage. Now remember that this is an example of simulated data, meaning that while in reality we only have shelter use data and we oftentimes use that as a proxy label for the outcome variable of interest, in this example we can actually look at homelessness versus shelter use. Our simulated data allows us to compare analysis of data when using shelter use data as a proxy for true homelessness. So we run two logistic regression models for those in poverty. Model 1 estimates the probability of homelessness on the y-axis as a function of health status on the x-axis. This is represented by the pink curve in the graph on the right. So since this model uses true homelessness, which remember is our outcome of interest, this would be an ideal model. However, in reality, administrative records only include those in shelter, not necessarily everyone experiencing homelessness. So this first model here is ideal, but not realistic to something we would be able to run. Now, Model 2 estimates the probability of shelter use on the y-axis as a function of health status on the x-axis. This is going to be the blue curve in the graph. Now, this is going to be a more realistic model, but remember it does not capture all individuals experiencing homelessness. So looking at that graph on the right, we can see that the blue line dips below the pink line. This means that when we use shelter data as a proxy for homelessness, we underestimate the effect of health issues on homelessness. So why does that matter? Well, if people were prioritized for housing based on shelter data analytics, those with severe health conditions may rank lower for housing access than they would if the data captured all forms of homelessness, not just those visible through shelter use. As a result, the very individuals most vulnerable to poor outcomes could be deprioritized. Thinking about Jessie, this could mean that people who don't appear in shelter data for other reasons as well, like safety and stigma, may also be deprioritized if in the future they do seek homeless services. So, what can we do about it? We encourage you to start by making data analytics aware of how data is shaped by societal biases. Ask yourself and others, how was the data generated? What does data intake look like? Aim to contextualize data with experiential knowledge of those who are represented in the data, people like Jessie. Remember, this is what the FAIR 2 framework hopes to facilitate. When possible, try to integrate other data, like food assistance data, where homelessness may be identified in other ways. This may indicate additional people experiencing homelessness that may not be represented in the shelter use data alone. Finally, use data and models to identify who is more likely to be left out of administrative data or impacted by bias. Let's revisit Casey, the social worker looking at LGBTQ+ representation in shelter data. What can Casey do about not seeing LGBTQ+ people in shelter data, even though they know that this population isn't unaffected by homelessness? Well, Casey can be transparent about how data is shaped by societal biases and seek experiential knowledge to inform data analytics. They can talk to people like Jessie to learn more. Overall, we see that Casey realized, I can't conclude that LGBTQ+ people don't need homeless services. I don't have all the data on all people experiencing homelessness, only on individuals who used shelters. I need to understand the context around shelter use and who is left out of the data, like Jessie. Finally, as social workers, researchers, and data analysts, it is our responsibility to advocate for equitable and consistent data practices. Whenever possible, advocate for inclusive options, accessibility, provider training to reduce bias, and the addition of experiential knowledge in informing data practices. We want to advocate for safer and more supportive housing services, which in turn will lead to a more equitable representation in administrative data, thus reducing label bias. And that concludes Module 3 on label bias. We'll see you in Module 4.